Welcome to The Explainer. Today, we're diving straight into the fascinating business mechanics of healthcare access. I mean, have you ever really stopped and wondered what happens behind the scenes of your health coverage? Or better yet, when you pay for health insurance, where does your premium actually go? Well, today, we're decoding the financial and regulatory machinery that dictates how managed care entities operate. We're going to look at how they balance costs with care, and ultimately how those massive business decisions impact everyone's access to healthcare.
And to do this, we're not just guessing here. We're looking directly at the SASB standards, specifically the Managed Care Industry Standard. This isn't just a loose set of guidelines, it's the official regulatory framework overseen by the International Sustainability Standards Board. It's literally the exact benchmark that managed care entities use to report their societal impact and financial sustainability to investors. So we'll be using this exact standard today to really decode how their operations work.
Okay, let's dive into this. We've got 5 quick chapters on our roadmap today, starting with the Healthcare Access Challenge, looking at the managed care model, digging into the medical loss ratio, exploring how vulnerable patients are protected, and finishing up with how we measure what actually matters.
Chapter 1. The Healthcare Access Challenge, Balancing Cost and Care. Let's just start by framing the really big, universal problem the healthcare industry faces right now. Across the globe, rising healthcare costs present just a massive hurdle. And this hurdle directly impacts the segments of the population that historically have much lower rates of insurance coverage.
Now, this might sound a bit counterintuitive, right? But the SASB standards points out a really crucial reality. In jurisdictions where private health insurance is the norm, the absolute primary way managed care entities improve access to healthcare is actually by strictly limiting plan costs and rate increases. By aggressively controlling the cost of the insurance plans themselves, coverage becomes more affordable. And when it's more affordable, that directly expands access to care for the populations that actually need it most.
Which brings us nicely to Chapter 2, the managed care model, the business of health coverage. So how does the industry actually pull this off? Well, it all comes down to the managed care business model itself, which operates under a very strict dual mandate. Basically, they have to control those costs we just talked about, but they absolutely must do so while maintaining strict regulatory compliance.
These managed care entities are navigating a literal maze of regulatory and business challenges. On one hand, they're constantly pushed to limit plan costs and rate increases. But at the exact same time, they have to comply with evolving regulations that are actually intended to control those very costs. On top of that, they're legally mandated to ensure that all applicants get access to coverage regardless of their health status, gender, or pre-existing conditions. And all of this is happening under an intense, increasing public focus on the sheer cost of healthcare. It is an unbelievably complex balancing act.
Which brings us to a question that I know we've all asked ourselves at some point. When you pay your monthly premium, where does that money actually go? What happens to those funds the second they leave your bank account? Understanding this, what we could call the journey of a premium, is absolutely key to understanding how this entire industry is held accountable.
That takes us to Chapter 3, the medical loss ratio, tracking the premium. To literally follow that money, regulators use a very specific sustainability metric. In the standard, it's known as HCMC to 240A.1. This is where the industry's financial accountability is tracked in black and white.
The total cornerstone of this accountability is the medical loss ratio. Under the SASB standard, the medical loss ratio is simply the percentage of total healthcare insurance premiums spent directly on medical claims and efforts to improve the quality of care. This single metric forces transparency. It completely stops companies from just collecting premiums and pocketing the vast majority as profit.
And this brilliantly illustrates how the pie is split. Regulations dictate that the vast majority of your premium must be spent on actual medical claims for patients, alongside specific quality improvement efforts. Only whatever is left over can be touched for administrative costs and profit. The medical loss ratio pretty much guarantees that the focus remains heavily on funding patient care.
So let's demystify the math a bit. How is this actually calculated? The standard lays it out perfectly. First, the entity adds up its incurred claims. That's the total amount spent on medical claims paid out to policyholders, including the direct payments to doctors and hospitals. Second, they add in their expenditures for activities that improve the quality of care. And finally, they just divide that sum by the total healthcare insurance premium revenue they collected.
Now, you might be wondering, what exactly counts as an effort to improve the quality of care? Because they can't just write off anything, right? The standard defines these very strictly. patient safety programs, preventative care efforts to catch illnesses early, health management programs for chronic conditions, and vital investments in healthcare technology. These have to be tangible activities that genuinely enhance the delivery, effectiveness, and safety of healthcare services.
But true transparency means you have to slice the data. Managed care entities can't just report one massive blended number. The SASB standard actually requires them to disaggregate or break down their medical loss ratio. They have to report the ratio separately across specific segments: small employer groups, large employer groups, and individual retail plans. This ensures that costs and care are balanced fairly across all types of customers, not just the most profitable ones.
Chapter 4. Protecting Vulnerable Patients. Access for everyone. So now that we know how the money is tracked, let's look at how entities decide who gets coverage and at what price. This is guided by another key metric, HCMC 240A.4. When an insurance company sits down to figure out plan pricing and formulate policies for customer access, they have to navigate some highly regulated patient factors. The two biggest ones: pre-existing conditions and general health status. Regulators require really strict disclosure on exactly how companies integrate these considerations into their business practices. Let's look at the exact wording from the regulatory text. A pre-existing condition refers to any medical condition, illness, or injury that existed prior to the application for or enrollment in a healthcare plan. This includes chronic conditions, previous surgeries, even ongoing medical treatments. Managed care entities are legally required to integrate these considerations impartially and ensure applicants have access to coverage absolutely regardless of these past conditions. Then we have health status, which is defined as the overall physical and mental well-being of an individual. This can be affected by factors like medical history, current conditions, lifestyle choices, and family medical history. And it goes beyond just defining these terms. The standard actually requires entities to disclose the specific internal systems they use to monitor their own compliance with jurisdictional laws regarding access for patients based on these exact factors. Chapter 5. Measuring What Matters, the Future of Accountability. So why does all this meticulous tracking, calculating, and defining actually matter? Well, it matters because tracking these specific numbers is vital for investors who are trying to evaluate the true enterprise value of these managed care companies.
But more importantly, it matters profoundly for society. The source material makes one thing incredibly clear. By limiting plan costs and successfully navigating these regulations, quote, these improvements most significantly affect segments of the population that tend to have lower rates of insurance coverage. That is the ultimate goal here. The rigorous accounting standards we've explored today aren't just about math on a spreadsheet, they're directly tied to protecting and expanding access for the most vulnerable populations among us.
Standardizing the way we measure healthcare access, premium spending, and patient protections, it forces an incredible level of transparency. So I'll leave you with this final thought. How might standardizing these exact metrics across the entire managed care industry change the future of global healthcare access? By requiring companies to prove their financial dedication to patient care through hard data, we just might be looking at the blueprint for a much more equitable healthcare system. Thank you so much for joining me on this explainer, and definitely keep asking the big questions.